Assalamualaikum everyone. My name Muhammad bin Muhammad IDRUS. I'm from RSR 243A. I'm the first presenter for my team. My team get knee for our main topic. So I'm the first. I will present about anatomy of the injury. What is knee? Knee is the one of the largest and the most complex joint in our body. The knee included the thigh bone femur to the shin bone tibia, the smaller bone that run alongside fibula, and the kneecap, as we call patella, the other bone that make the knee joint. Okay, this is the figure that our knee. This side you can see the ACL, the LCL, and patellar tendon and quadriceps. And you can see the patella, apical kneecap, and articular cartilage, the ACL, meniscus, tibia, fibula, and other F. Okay, anatomy of the injuries. I do research and I get the nine of the injured. First is the chondromalacia patella, knee osteoarthritis, knee effusion, meniscal tear, ACL, PCL, and MCL, gout, septic arthritis, patella subluxation, and patella tendonitis. Okay, what is the chondromalacia patella? Chondromalacia patella is the irritation of the cartilage on the other side of the kneecap, apical patella, causing knee pain. This is common cause of the knee pain in the young people. Okay, this the normal one. You can see the femur and the kneecap. In the healthy one, and we can see the chondromalacia patella that you can see the red one. Then you can see that the irritation of the cartilage on the other side of the kneecap. Okay, knee osteoarthritis. Arthritis is the most common form of the arthritis, and the other effect the knee. Knee caused by aging and wear and tear of the cartilage. Arthritis symptoms may include knee pain, stiffness, and swelling. In the figure, you can see the normal knee cartilage, the normal knee of the cartilage, and you can see the injury cartilage that the knee osteoarthritis. So next one is knee effusion. Knee effusion is the fluid build up inside the knee, usually from inflammation. Any form of the arthritis or injury may cause by a knee effusion. So we can see the normal one, and you can see knee that get the infusion. The fluid is accumulate at the knee joint that will cause the knee effusion. Okay, meniscal tear. Meniscal tear is the damage to a meniscus that cushion the knee. Often occur with twisting the knee. Large tear may cause the knee to lock. So you can see the figure. You can see that this is a meniscus. So meniscus get tear inside of. You can see the image that the meniscus get tear. That will cause the meniscal tear. So the next one is ACL, PCL, and MCL. SAF can we call the anterior cruciate ligament, PCL posterior cruciate ligament, and the MCL medial collateral ligament. This part, this SAL, MCL is the common for the athlete that and this is the serious for the athlete, and this part become strain and tear in the injury and tear that injuries make. So we can see the medial collateral ligament get tears or strain, or ACL cruciate ligament get strain, and the one is posterior cruciate ligament get strain. Okay, gout. A form of arthritis caused by build-up of uric acid crystal in a joint. The knee may be affected, causing episode of the severe pain. So the normal joint, you can see the severe synovial fluid. You can see the not affected the gout, and we can see joint with gout. You can see the uric acid in the uric acid combined with synovial fluid that you can see in the image. So that is the gout make it septic arthritis. Septic arthritis is the infection caused by bacteria, virus, or fungus that the knee can cause inflammation, pain, swelling, and difficult moving in the knee. Although uncommon, septic arthritis is a serious condition that usually gets worse quickly without treatment. So when we get the septic arthritis, we need to go to treatment quickly, because this may affect the long term. So you can see the bacteria in the synovial fluid that affected the knee. So patellar subluxation. Patellar subluxation is the kneecap abnormal or dislocate alongside the thigh bone during activity. Knee pain around that kneecap result. So we can see the normal position. The normal position that the patella stay in the middle, and we can see when the patella get subluxation, we can see they dislocate from the first position that we call the patellar kneecap subluxation. Okay, patellar tendonitis. Patellar tendonitis is the inflammation of the tendon connect the kneecap patella to the shin bone. This occurs mostly the athlete from sitting jumping. So you can see this is side of the tendinitis. You can see is connect with the tibia, the patellar tendon, the tibia, and the patella. So mostly the injured, mostly the volleyball and other sport that cause the patellar tendinitis. So that's all for me. Thank you.
Hi, Assalamualaikum. My name is Siti Aisyah binti Baharum from SR2433A. So, I am the second presenter. I will present about common knee injuries in sport. So, as we know, knees is one of the most common body parts to be injured in sports. Generally, knee injuries caused by twisting or bending force applied to the knee or a direct blow such as from sports, falls or accidents. Risk factor for knee injury include overuse, improper training, having osteoporosis, and playing high-impact sports that involve sudden changes in directions. Knee pain and swelling is the main sign and symptom of knee injury. So, we continue with the next slide. So, as we can see, this is the image of the knees. On the top is the femur. At the least is tibia. So, we have ligaments. Okay, 4 ligaments at our knee, which is on the center. We have posterior cruciate ligament and anterior cruciate ligament, which is we also call PCL and ACL. So, on each side of the knee, we have medial collateral ligament and lateral collateral ligament. So, and the tendons, which is above the tibia bone, we call medial meniscus and lateral meniscus. Okay, so there are common injuries that happen to the knee, which is we have fracture, dislocate, ACL, PCL, MCL, and LCL. The first one I will present about fracture kneecap, or we also call patella. So, patella is the most common bone broken around the knee. It is a small bone located in front of the knee joint where the femur and tibia meet. So, a break can occur at the top, center, or lower part of the bone. Sometimes, fracture occur in more than one area of the patella. So, there are 4 types of patella fracture, which is stable fracture, displaced fracture, comminute fracture, and open fracture. The second one is dislocation of knee. Before that, we have to know that the patella connects the muscles in the front of the femur to the tibia. So, a sharp blow to the patella, as in a fall, could also pop the patella out of place. Dislocation of knees occur when the bones of the knee are out of place either fully or partially. For example, the femur and tibia can be forced out of alignment and the patella can also slip out of place. So we move on to the next slide. ACL. Okay. At the knee, we have 4 ligaments, 4 types of ligaments, which is on the center we have anterior cruciate ligaments, posterior cruciate ligaments, and on the each side of the knee we have lateral collateral ligaments and medial collateral ligaments. So, before we go to ACL, which is anterior cruciate ligaments, we have to know about cruciate ligaments. Okay, so the cruciate ligaments are found inside the knee joint. Okay, they cross each other to form an X with the ACL, which is anterior, with the ACL in the front and PCL in the back. So what they do, they control the back and force motion of the knee. Okay. So the ACL, what ACL do? The ACL prevent the tibia from sliding out in front of the femur, as well as provide rotational stability to the knee. What ACL do? Okay, so what the functions of ACL? It helps to stabilize the joint and can be damaged by sudden violent twisting motions or blow. Okay, so furthermore, collision sport put the player at risk for this injury, and the risk is it compound when the player is tackled. Okay, and also people can get this injury ACL when they run or jump improperly, or they have suffered a fall. Okay, so next is PCL. Okay, PCL is posterior cruciate ligament tear. Okay, PCL keep the tibia from moving backward too far. Okay, for your information, PCL is stronger than ACL, and it's injured less often lah. So PCL has two parts that blend into one structure that is about the size of a person's little finger. PCL tears tend to be partial tears with the potential to heal on their own. So people who has injured just their PCL are usually able to return into sports without knee stability problems. PCL, posterior cruciate ligament, also often injured from a blow to the front of the knee while the knee is bent. So this often occurs in motor vehicle crashes and sport-related contact. Okay, so the last one, we move on to the last one, which is collateral ligament injury. Okay, so we have two collateral ligament, which is on the each side of the knee, which is medial collateral ligament, and lateral collateral ligament, which is we always call MCL and LCL. It is easily injured because a knee joint relies on these ligaments and surrounding muscles for stability. So, any direct contact to the knee or hard muscle contraction, such as changing direction rapidly while running, can injure the knee ligament. So, collateral ligament injury usually caused by a force that push the knee sideways. Okay, the inside ligament, which is we call medial collateral ligament, it connect the femur to the tibia. MCL injury usually caused by a direct blow to the outside of the knee and are often sport related. So the next ones, LCL, lateral collateral ligament. Okay, so the lateral, which is the outside ligament, we call lateral collateral ligaments. It connects femur to the smaller bone in the lower leg, which is fibula lah. Okay, so ACL injury usually caused by a blow to the inside of the knee that push the knee outwards, and it occurs less frequently than others. Okay, that's all from me about common knee injury in sports. I will pass to the next presenter. Thank you.
Okay, Assalamualaikum and very good morning to our lecturer, Dr. Zulkarnain, and to all my friends. My name is Muhammad Hafiz bin NASIR from SR2433A, and I am the third presenter. So today I will present about the procedure of kinesiotaping for knee. Okay, what kinesiotape is used for? It actually depending on the way kinesiology tape is applied. It can be used for a variety of different things, including but not limit to, such as muscle inhibition, facilitation, pain relief, decreasing swelling, proprioceptive stability, and tissue decompression. Okay, next I will show you some video tapping technique of knee pain. Okay, firstly we are going to twist and tear the adhesive of the tape. Okay, we are going to place this with 80%, so we are going to stretch all the way and lay down with absolutely zero stretch. Okay, take out next piece. We measure the point at the kneecap around the kneecap and lay that ankle point on. The quadrat muscle must on the tight muscle. We're gonna apply this with 25% stretch. You are going to trace the outer edge of the kneecap with the edge of the tape. As you wrap down, you are going to apply 80% stretch and lay down 0 stretch. Okay, same with the left part. On the right part, take out the next piece. We measure the point at the kneecap, around the kneecap, and lay that echo point on the quadricep muscle, on the thigh muscle, and we are going to apply this with 25% stretch. You are going to trace the outer edge of that kneecap with the edge of the tape. As you wrap down, you are going to apply 80% stretch and lay down with 0 stretch. That's what you see to a wide strip. Make sure you cut that down in the center and trying to go to the first square. Okay, apply to a tibia tuberosity, just slightly inferior. There's no stretch on the ends and lay down smoothly. Make sure bend the knees 19% and then the fingers, you can literally bears the patella, and this is one going to go to the lateral to the patella and finish it gently. The fingers are applied but roughly where the first tape finish. There's no stretch at 90 degrees, just mold it and a little bit on the same inner side, so overlap it just a few milliliters and then it finish gently. Okay, about 90-degree angle, and we are going to take our first strip and 0% stretch, and going to put this right over point of the pain and lining that piece up and down the upper portion of the leg of the femur. We are going to ends down with 0 stretch, so only the middle of the tape has 80% stretch, the ends have 0 stretch. Okay, take another piece of the tape. We are going to apply nice even stretch on this as well. We are going to align with the lower portion of the leg, going right over the point of the pain and lay down with absolutely 0 stretch. Okay, place the anchor right between of the two pieces, and we're going to remove the paper backing. With this piece, we are going to go to right over the point of the pin as we lay that down with about 20% stretch, and we're going to bend the tape. We're going to lay that down absolutely 0 stretch.
Hi, Assalamualaikum. My name is LUQMAN HAIKAL bin ROZAINOR. I'm from RSL 243 3A. I am the 4th presenter of this group. Okay, let's begin. On this video, I will talk about the procedure of knee tapping or knee strapping. Strapping is known as the application of strip of adhesive tape, one overlapping the other to cover and exert pressure on a limb. Okay, strapping usually is used for rehabilitation for the athlete to recover from their injuries. Many therapists use this kind of strapping or taping to recover the athlete injuries. Okay, on this picture, as you guys can see, there are so many kind of tape. It has two categories, which is the corrective and the support. For the corrective, it is known as the major tape that used to cover the major spot of the injury. Meanwhile, for the support, it is a kind of tape that used to support around the major tape. Okay, for the corrective tape, there are two types that that are very useful for the knee injury, which is a leukotape and coverall tape. Meanwhile for the support tape, it has elasticon and elastoplast and wet proof. Okay, next, the elastoplast rigid strapping tape is a very useful tape to restrict the joint movement, which is on this case is on the knees. It is recommended to use this tape about 50 mm. And then for the elastoplast elastic adhesive bandage, it is very useful to compress and support the joint or muscle of the knees. It is recommended to use this kind of tape for about 75 mm only. Okay, for the next slide is the variety technique of taping and strapping in the knee. There are three kind of technique that are very useful for the knee injury. For the first one is known as the McConnell tapping, and the second one is MCL tapping, and for the third one is anterior knee tapping. Okay, for the McConnell tapping, it is also known as a patella tapping. It was first introduced by Jenny McConnell in 1984. This kind of tapping is a very useful treatment for the patella femoral. It is to recover the position of the head of the knee, which is called patella. Okay, on this picture, as you guys can see, there are two differences, which is the knee without tape and the knee with tape. For the knee without tape, it will make the knee cap or knee head or patella out of the alignment, which is very harmful for the athlete. Meanwhile, for the knee with tape, it will make the patella in normal alignment, which is it is good for the athlete to rehabilitation. Okay, here's the video on how to apply the McConnell tapping for the athlete at the knees.
Okay, like so. Another strip. That's just for the tape to put to. So now, as I said before, there's lots of different ways that the kneecap could be moving. It could be tilted that way, so therefore you want to tape at the bottom to put it down. It could be tilted that way, so you want to put tape at the top to put it that way. It could be tilted that way, so therefore you want to put tape on this side of the kneecap. It could be tilted this way down here, so you want to put tape on that side of the kneecap. So the pain, what you've got to do is look at the kneecap itself and decide which way you want to tape it. I'm going to show you where we're going to bring the kneecap over this way. So over the top of that hyperfix underneath, I'm going to use some strips of tape. So I'm going to measure them, okay, and then I'm going to place it on the lateral border of the kneecap, get nice and relaxed, okay? And I'm just going to put a little bit over here towards the inside, okay? Then I get another strip, and again I'm going to look at the outside border of the kneecap. I'm going to push it with my finger across to this side. If you see it right, you've got a skin crease on the inside. Now,
okay, for the next technique is MCL tapping. MCL stands for medial collateral ligament. MCL tapping is useful to provide a high level of support and protection of the MCL. The MCL is located at the side of the knee. As you guys can see on this picture, that a stone of the medial ligament, which is having a force from the inside of the knee, which is to make it the medial ligament to become torn. Okay, this is a video for the MCL tapping. It will show you how to apply the MCL tapping for the injured athlete.
So I use LUQMAN light underneath my anchors, around the quad and lower leg, just for comfort. I go with the rigid. So the knee should just be positioned at about 10 degrees of flexion, and then we start with some crosses over the medial joint line. So in my opinion, it's It's best not to come too far over the midline, just so you can achieve full flexion after the tape's been applied. To make it a little bit more restricting to valgus, you can really pull down on that and get a few creases in the skin. That's just a way we can sort of tighten up a bit. Have that whole medial joint covered. Finish it off with a big cross across like that. Re-anchor that, be rigid. Just get them to flex the knee. Come down, make sure it's comfortable, and then we overwrap with LUQMAN. It's just one long continuous application of the LUQMAN, just applying a little bit of stretch over the medial side and nice and lightly around the quad and lower leg. You can finish it off with your rigid.
Okay, for the third technique, which is anterior knee tapping. The anterior cruciate ligament is located in the inside of the knee. This kind of tapping is similar to MCL tapping, or known as medial cruciate ligament tapping. Okay, here's the video on how to apply the anterior knee tapping for the athlete.
So you need to position your patient so that you've got the knee side flexion. We've got the lower anchor halfway around the calf. And you want to ensure that the patient's probably got about 30 to 40 degree knee bend. Okay? The upper anchor is going to come forwards from around back. Okay, and again it's a knee complete ring. Okay, so you want your rigid tape coming over towards your tibial tuberosity. It's tracking straight back to the anchor. Okay, but you need to pull equally in each direction. So you're trying to replicate the posterior draw of the tibia relative to the femur, similar in the action of your anterior cruciate ligament. Okay, I'm going to repeat again. Okay, last two strips. Okay, we'll refinish the anchor at the bottom now. And refinish this up. Okay. So we're going to use two strips. Either side of the joint now to secure the taping techniques in place. So about 10% stretch. There's no stretch in the last inch. Round low calf. If you can just contract your quad for me there, that's perfect. Boom, female. Okay, and strip all the way around, making sure that your athlete's quad contracted. And the same on the calf. Okay, flatten everything down. And that's your ACL.
Okay, that's all from me. Thank you.
Okay, hi, Assalamualaikum. My name is IZZATI NABILAH BINTI YUSNIZAN. I'm from RSR 24338. I'm a fourth presenter. So today I will present about do and don't of knee pain. So we can move to first slide. Okay, firstly I will go to do. Okay, firstly it's do exercise. Exercise is a good therapy for knee pain, but it needs to be the right of exercise. I mean, we can do exercise, but we must choose suitable exercise for our knee pain. So, secondly, pounding your knees with high impact exercise or overdoing during workout could make your knee pain worse. So that we don't have to do exercise that can make our knee worse. So the cardio exercises strengthen the muscles that support your knee and increase flexibility. For example, from cardio exercise is walking, swimming, water aerobics, and stationary cycling. Okay, swimming we can do exercise in water, but walking is recommended for people with knee pain because it's a low impact activity. If your joints are painful and stiff, start slowly and walk up to 20 minutes of walking per day. So we can move to the next slide. Okay, do use rice. So what is a rice? R for rest, I for ice, C for compression, and E for elevation. Okay, it's good for knee pain caused by minor injury. Okay, firstly, we must give your knee some rest. Secondly, apply ice to reduce swelling. Thirdly, we must wear compressive bandage, and the last one is keep your knee elevated. So we can move to do use heat and cool. Okay, if your knee pain flares, try hot or cool treatments. Use ice for new injuries to reduce pain and swelling. After a few days, use heat to tackle soreness, and for loosening the muscles. Okay, if you feel down or hot or your knee hot, use ice to dull the pain and reduce bleeding. Okay, benefit of ice for knee pain is ice is good for fresh injuries. It provides relief against inflammation. Okay, so next, do get expert advice so that we can do an appointment with a doctor, and we can talk to your doctor. You don't have to deal with knee pain alone. Your doctor might prescribe medication or give you a steroid shoot to help. And doctor also might talk with your about surgery to replace your own joints or ligaments. So that how do you want to talk to a doctor? Okay, when you're talking to your doctor uh, about your knee pain, be as specific as possible. Describe when it hurts, where it hurts, and what it feels like when it hurts. So you also can discuss to your doctor about the activity that make your knee pain feel worse, and what activity can make your knee feel better. So we can move to don't. Okay, which is firstly, don't sleep in the wrong position. Okay, means that if we sleep in the wrong position, we can make your knee pain worse. And we must to try out different position, which is back or side sleeping for less knee pain. Okay, if on your back, put a pillow under your knees for support, while on your side, keep your knee in placid position to minimize pain, and try to never sleep with your legs crossed. So okay, we can go to the next slide. Okay, don't forget to stretching. The muscles around your knees can be tight, and that can lead to painful injuries. Daily stretches can prevent that and muscle pain. Ask your doctor or physical therapist for easy move to help your limber up before you walk or do any other activity. Means when we knee pain, we also must to do a stretching. We can do a simple stretching. Don't do a hard stretching that can make knee worse. Okay, so the last one is the okay. Then keep wearing the same old shoes. Right? Okay, shoes can stretch and wear out after a while. Don't keep wearing your favorite pair after their support and threads have worn out. You may find that new shoes that support your feet and ankles will ease your knee pain. That means when we have a knee pain, we don't have to wearing a same old shoes because uh, we wearing the same old shoes, it can make our knee worse. So we must to try out to wear or buy a new shoes that are suitable with our knee. So that's all from me. That's all from me. So thank you.
Hi, Assalamualaikum. My name is ALIZA Binti ADNAN. I'm from SR2433A. I'm last presenter. Today I want to present about equipment required. Have a C equipment for knee injury. Okay, first is kinesiology tape. Kinesiology tape is a very stretching sport tape. It's used to provide support by stabilizing joint and muscle. In the following method, kinesiology tape is used for full kneecap support. This is ideal for patellofemoral pain syndrome or pain around your patella in the front of your knee. Okay, second is strapping. Knee strapping is practiced to use to release knee pain. It's also done to improve knee support, which may treat and prevent variant injury. The practice involves apply special tape around the knee. The tape is placed on the specific location, which is said to manage pain by controlling muscle and joint. Third is underwrap. It is form primarily to protect sensitive skin from the adhesive glue commonly used on sport tape. Underwrap is a lightweight foam wrap designed to protect the skin from tape and safe during taping techniques use sport tape. This lightweight line from film tape is used to protect the skin from the glue used in the zinc oxide style tape. It is simply wrapped around the area to the B tape and the tape applied over it. Okay, next is season. Next is knee support. Knee support or support to be worn when you have pain in your knee. Some people use them to prevent knee injury during sport. Braces are made from the combination of metal, foam, plastic or elastic material and strap. Okay, last is ice pack. Ice treatment is the most commonly used for acute injury. Ice pack can have minimal swelling around the injury, reduce bleeding into the tissue, and reduce muscle spasm and pain. Last is conclusion. In my opinion, a strong knee is also important in our daily life. This is because if our knee hurt, our work or daily life will be disrupted. Therefore, tape, strap, and kinesio taping can help reduce knee pain. Thank you.